Corporate wellness, how companies are tackling burnout. Burnout is not a personal failure. It's a systems warning. Too much load, too little control, weak recovery, and blurry meaning. The companies that are actually reducing burnout don't start with yoga classes, they redesign work. They set guardrails for time and focus, train managers to balance demand with capacity, fund real mental health access, and measure the right signals so fixes stick. Begin with workload clarity. Teams publish a rolling, visible capacity plan: what's committed, what's at risk, and what gets dropped if surprise work arrives. Managers negotiate scope before adding projects. Trade-off first becomes muscle memory. Individual goals shrink from quarterly wish lists to a few outcomes with weekly checkpoints. When priorities are fewer and visible, after-hours emergencies fall because there are fewer hidden fires. Time is engineered, not hoped for. Companies set meeting hygiene rules that are easy to enforce. No meeting blocks for deep work. 25 50-minute defaults to leave breath between calls, mandatory agendas with decisions and owners, cameras optional unless collaboration requires it. Focus windows land on calendars as policies, not suggestions. For distributed teams, golden hours for collaboration sit beside declared dark hours when messages wait. Right to disconnect becomes practical. Email sends can schedule. Chat statuses reflect time zones, and leadership models delayed replies. Incident channels and on-call rotations handle true urgencies, so the rest of the org can sleep. Performance reviews reward outcomes and team health metrics, not midnight presence in chat logs. Manager training moves from soft platitudes to hard skills. New leads learn workload triage, expectation setting, and one-on-one scripts that spot early risk, sleep changes, cynicism, detachment, error spikes. They practice saying, "Here's what we're pausing," and escalate when demand outstrips capacity. Skip-level check-ins and anonymous pulse surveys validate whether these skills are showing up in the week, not just in slide decks. Benefits shift from performative to usable. Mental health access means same-week therapy slots, multilingual providers, and clear coverage. Employees can pick between in-person counseling, secure teletherapy, and peer support groups. Self-guided programs exist, but a human is reachable within 24 hours when flags appear. Caregiver support includes backup care days, flexible starts, and elder care navigation. Financial stress gets addressed with budgeting tools and debt counseling. Money worries are workload for the brain. Hybrid and frontline realities are designed in. Office roles get quiet floors, bookable focus pods, and team days that prioritize alignment over attendance theater. Frontline teams, retail, plants, hospitals, contact centers, get predictable rosters, bid systems for shifts, micro-break protocols, cooled rest spaces, and safe staffing ratios. You cannot breathe your way out of a double shift. Staffing is wellness. Tech reduces friction without becoming surveillance. Tools consolidate notifications, batch alerts, and default to do not disturb during focus blocks. Dashboards show team-level load, not individual keystrokes. Privacy is explicit. What is tracked, why, who sees it, and how long it's kept. Employees can export or delete their data. Consent is a setting, not a slogan. Recovery is baked into calendars. Minimum PTO actually gets taken because approvals are fast, blackout dates are few, and leaders post their own out of office. Quiet weeks follow major releases. Team rituals, walking one-on-ones, camera off Fridays in the last hour, no meeting lunches, normalize human pace. Micro-recovery is taught like any skill. 2 minutes of 4 to 6 breathing after tough calls, a 10-minute sunlight walk post-lunch, stretch ladders between blocks. Culture reconnects effort to meaning. Leaders tell the customer save story alongside the revenue hit. Wins are recognized specifically and quickly. Everyday help, not just heroics, gets airtime. Psychological safety is made operational. Ideas are logged in a shared backlog. Credit is attributed in retros, and mistakes trigger learning reviews instead of blame hunts. Measurement separates signal from noise. Lagging indicators, attrition, sick days, error rates, are paired with leading ones. Focus time adherence, meeting load per person, average after-hours messages, therapy utilization rates, PTO booked versus taken, and self-reported energy in weekly pulses. Teams choose 2 to improve every quarter. Leaders publish before-after so people see cause and effect. A simple 90-day playbook shows how change lands. Days 1 through 30, audit meetings, set no meeting blocks, publish capacity boards, train managers on trade-offs, and switch on same-week therapy access. Days 31 to 60, redesign on-call and incident paths, pilot focus pods and quiet floors, launch caregiver support, and install micro-break queues at frontline sites. Days 61 to 90, run a quiet week after a major milestone, publish metrics, hold learning reviews, and lock in policies that worked. Individuals still have levers. Claim your focus block, trim notifications, take real lunch away from screens, close the day with a 2-minute shutdown ritual, and book PTO early. But the bigger lever is organizational. When systems respect time, clarity, and recovery, individual habits flourish instead of fighting the tide. Burnout falls when work is right-sized, time is protected, help is reachable, and meaning is visible. Companies that align design, benefits, and measurement turn wellness from a perk into how work works. For policy templates, manager scripts, and rollout checklists that reduce burnout without theater, visit globalinfovita.com.